Greetings, everyone. Welcome to another Prep Hour with Steve. Today is Monday, the 2nd of December. It's just gone 4:30 p.m. in my part of the world, which is Brisbane, Australia. And I welcome you wherever in the world you may be and whatever time it may be. If you've just joined us, just type in a hello, put it in your chat box so I can, as a text message, and just do a shout out and put your location and what time it is. I'll just pause, make sure it's all working fine. Yep, so just type in your message, everyone. Hello to Grishma. Well done. Hello, Grishma. Just get everyone to type in where they are. Hello to George over there in the other side of the world in Bulgaria. Hope it's not too cold over there. But so good morning to you in Bulgaria. Good morning, Grishma. Everyone just type in your shout outs, please. And then we're going to get started with our topic today, which is going to be speaking exam tips, particularly clinical communication skills. Hello to Rashmi here in Brisbane, I believe. Good to see you here, Rashmi. Hello, Dr. M. Hello to Jimmy Jose. Madhu is here. Hello, Anjali from India. Well done. Hello, Prima over there in Dublin. Who else have we got here? I'm getting a wave from rehab. Hello, hello. Lots of people coming along online now. Good to see you all joining in. All right. Well, we should get started as everyone's coming in. Now, this is a live and interactive session, so you're welcome to type in any questions you have as we go. Today's topic is speaking, so I'd ask you restrict your topics to speaking. If you have a little bit of the time at the end, we might be able to delve, but really we are just going to focus on speaking today. So let me bring up my slides, everyone. Welcome to Juliet over there in Namibia. That's far away from here. Hello to Meti in Bahrain. We have lots of people here. That's excellent. Okay, so we're going to talk about the speaking exam, everyone, and particularly the clinical communication skills. And the first, let's begin by just doing a quick overview so we all understand what the actual exam is all about. So first question I'd like to ask is, who will do your interview? That's the first question. Who will do your interview? Will it be an examiner? Will it be an interlocutor? Will it be a real patient? Who is going to do that interview? The good news is it's not your examiner. So that removes that level of fear away from the situation. The answer is it's an interlocutor. So they are not an assessor. They're designed to take the role of the patient and to support the communication process. And of course, record it because the answers are then sent to the assessors who will actually listen to your audio and grade you in that way. Okay, next question is, how long does this whole speaking test take? Does anyone have an answer for that? If you think you know the answer, just type it in. How long does the whole speaking test take? from when you walk into that little booth until the end. Type in what you think the answer is. While I'm waiting for that, hello over there in Egypt. Can see the Egyptian flag waving. Well done. Hello, Ibrahim. Also there, Gogo. Well done. George says 15 to 20 minutes. I think you're exactly right. I think more closer to 20 minutes by the time you do the introduction, right? And that's what happens next. There's a greeting and warm-up, which is not assessed. Probably by the time you begin the whole process and do your warm-up, perhaps 5 minutes has passed. And then after that, you're going to do the profession-specific role play. So always remember that. If you're a nurse, you'll be doing tasks common for nurses. Doctors will do doctors' tasks. Physios will do physio tasks, and so forth. In both role plays, you will take the professional role. You don't need to be the patient. All right. And how long do you have to prepare for each role play? Well, I think that's a pretty known answer. They allow about 3 minutes per role play. Now, during that time, you will have your pen in your hand. You can make notes, mentally prepare, read through the case, work out what the issue is, what's the patient's concern, and perhaps prepare some questions that you might ask to begin that role play. Okay, so you get 3 minutes to prepare. Exactly right there, Nevi-chan. And Adidevev, sorry if I'm not pronouncing your names right there. How many role plays will you do? Well, the answer is 2. You'll do 2 role plays. And how long will each role play last? I think this is a known answer too. I think people are familiar with this. How long will each role play last? So if it's 3-minute prep time, and I think you can say, I'm sure the answers, I'm just waiting for the answers to come in. Type in your answers. How long will each role play last? You've got 3 minutes to prepare for the role play before the role play begins. Someone said 3 minutes. No, that's 3 minutes for the preparation. Role play will go a little bit longer than 3 minutes. Yes, 5 minutes. Thank you there, Dr. Nair. 5 minutes. So 2 5-minute role plays. So if you add it up, you can quickly see why it will take 20 minutes in total. So that's what you can expect. You'll do 2 role plays back to back, but each role play will have 3 minutes to prepare, and each role play will be on a different topic. And that's the speaking exam. So you've really got about 10 minutes of real health professional communication to demonstrate your oral communication skills and language proficiency in the speaking subtest. George says, until the examiner says stop. Yeah, good point, George. Or not examiner, but let's call them the interlocutor. They will be monitoring time. So I don't think you need the responsibility to look at don't really need to clock watch. You should just be focusing on effective communication. But your interlocutor has the ability to also direct the communication and also wrap it up at the end. If the 5 minutes or so has passed, they may choose to end that and move on to the next role play. Good news is, in terms of assessment, even if you don't complete the role play, there's no actual assessment for task completion. It's really a snapshot of your communication skills. All right, but it's a good idea to try to work through the whole task, stay focused on your actual task without delving into a broader history. It's good to stay focused on the task you're given. Okay, let's move on. So in terms of assessment criteria, it's divided into 2 categories. Category 1 is the linguistic criteria. Intelligibility, that's another way of describing pronunciation. By intelligibility, we mean how easy is it to understand your speech. So that's one criteria. Second criteria is fluency. You don't want to speak too fast. You don't want to speak too slow. You want to speak at a nice, even pace. And remember, you're educating your educators, your health educators. So you want to speak at a speed where the patient can follow what you're saying, and also give them the opportunity to ask questions should they have any concerns. Appropriateness of language refers to having the right degree of formality. And I think with speaking, it's a bit of a balance. You want to build a good relationship with your patient so you can be friendly and encouraging and supportive. But at the same time, you may be explaining, serious, it's quite a serious conversation that you might be having. So you do want to keep that level of seriousness apparent within that role play. And resources of grammar expression, and that's what it means. It's grammar and vocabulary. It's a language test, so the ability to speak with good control, good sentence structure, word order, verb use. These are all important elements of your communication. Category 2 is the one that's interesting. Category 2 is the communication criteria. And this is about how well you interact with your patient. It's very, very important, as I'm sure you all know as health professionals. It's that ability to connect with your patients that is really highly valued in the health industry. So it's about relationship building with language, understanding and incorporating the patient's perspective into the role play, providing structure, that's organization in your communication, gathering information and giving information. These are all really important things, and we're going to look at those in a bit more detail. We'll look at all of them to some degree, but we'll certainly be looking at relationship building in this session. So within relationship building, how are we going to achieve a good relationship with our patients? Well, here's a few things we're going to cover. We're going to look at different subjects today. We've got 5 of them. Embedded questions, showing empathy, providing reassurance. We're going to look at positive language, and then we're going to look at risks and consequences, which can help us persuade a patient to follow our advice. Now, I'm going to need you to get involved in these sections. So the first one is just a little bit of work on embedded questions. When you're talking to a patient, you are going to need to ask some questions about their, about their life and their illness. And sometimes these questions may be personal, but you need that so you can provide the right care. But you will need to demonstrate a level of politeness. So I'm going to give you one example, and then I'm going to get you guys to complete the other sentences. So the first one here, it's a direct question, and it says, why have you come here today? The patient walks into your room, and you might say, why have you come here today? It's very direct. Or because it's perhaps the first sentence you say, you may decide to use an embedded question, which is a polite way of saying the same thing. And it's going to be like this, everyone. Could you tell me why you've come here today? Could you tell me why you've come here today? That's a polite question. A lot of people have difficulty with the word order. They might say, could you tell me? They've got that clause there, could you tell me? But then they'll say, could you tell me why have you come here today? But what we really need to do in this incident is, let me bring up my pen. We've got to reverse the order. Could you tell me why? And then we've got to reverse between the helping verb have and you. The you comes first. So could you tell me why you, and I've just used the short form, could you tell me why you've come here today? All right, that's the key, right? Is that clear, everyone? Does that make sense? It's a lovely embedded question. And your patient will feel that you're showing them respect, when you ask these polite questions. It's a natural way to ask. If you don't, sometimes it can sound a bit abrupt. Now, we don't want to use too many embedded questions, just one or two. And once we start asking questions, we can go into a more direct style. But it's a really lovely way to begin the communication, or perhaps midway through the role play when you're asking questions about a new topic. Now I'm going to get you guys to do a couple. So the next one says, how did you injure your leg? Now, how should we change that? How did you injure your leg? You can begin with, could you tell me? Or may I ask? Does anyone want to have a go writing an embedded question for that sentence? How did you injure your leg? Type in when you think you know what it is. And while we're doing, to keep the pace along, we can also do the second one. So what time did the accident happen? Could you tell me? So we've got two on the run here. We can do two at once. See if you can write out an embedded question. I'll check your language. Rashmi says, may please ask what happened to your leg? Not quite. We want to use the same pattern, everyone. You don't have to change the words. So we're going to use the same language. You don't need to introduce new words. Jojo's having a go. Could you please tell me, how did you hurt your leg? No, because we don't need the did, Jojo. We can remove that. And Joe says, could you please explain, how did you injure your leg? No, because you've got two past tenses there, Anjali. Let me show you. Could you tell me how you injured your leg? So how did we come up with this sentence? Well, what we did, this is the helping or auxiliary verb did, and it helps by giving us tense, past tense. But when we do an embedded question, we put the tense on the main verb and we remove the auxiliary verb. Easy. Could you tell me how you injured your leg? And there's your embedded question. So if you write, could you tell me how did you injure your leg? That's actually a sentence structure error. So you want to be able to use embedded questions accurately. So could you tell me how you injured your leg? All right. So I can see that's a tricky one for a few people. Would you tell me how you injured? Very nice. Helen got it. So this is a tricky one, isn't it? Carolina. Hello, Carolina. Could you tell me how you got it as well? So a lot of people did get it. Excellent. But a few people had a bit of difficulty with this one. And it is a hard one. So same with Juliet. You just got to remove that did. You've got to remove your auxiliary verb. All right. If that's clear, crystal clear, just type in CC for crystal clear. If you got any questions, you're welcome to ask. Okay, what about the next one? What time did the accident happen? What time did the accident happen? We'll follow similar patterns. Could you tell me? Or we can use other embedded phrases. Oh, that came up a bit early. Could you tell me how the accident happened? Could you tell me how the almost Rashmi, you've great. You just got to put your past tense on happen. That's all. Could you tell me what time the accident happened? Perfect, Hamid. That's it. Could you tell me? And I've just got a different one. Do you remember? But it could be any. So could you tell me is good. What time the accident happened? So notice the same pattern, everyone. We're removing the auxiliary verb and we're putting the past tense onto the main verb. Do you remember what time the accident happened? Could you tell me what time the accident happened? Quite a common question you might ask a patient who has had some sort of injury. Okay, let's try the next one. Now, same pattern, you might be getting the idea now. When did the pain start? Now, you know what we're going to do here, and we're going to put the tense on here. Well, try this one, everyone. And we can do the next one as well. How long have you had the pain? So we've got two going on. Feel free to write out your embedded questions for both of these options. Could you tell me the time of the accident? That's good, and Charlie. Could you tell me when the pain started? You're really getting it now, Rashmi. Good job. Could you tell me when the pain started? That's it. Beautiful. What about the next one? How long have you had the pain? Now, this is a different one. This is like the first one. We're going to have to reverse the order here. We're going to have to reverse the order. How long have you had the pain? Could you please tell me when that was good? Could you tell me when the pain started? Excellent, Jiva. Could you tell me how long? Almost, Hamid. You're just missing the have there. How long you've had the pain. So this one is, and look how I've shortened it. You can say it. Could you tell me how long you have had the pain? Because we're reversing the order. But when we actually say it in speech, it's more like, could you tell me how long you've had the pain? So practice that yourself. Get out your phone and record yourself using your phone. And you can use the contraction. Could you tell me how long you've had the pain, to get in the rhythm of the language? Okay, a couple more, everyone. And now we've got some, whoops, that's come up a bit early. These are yes/no questions now, because we're starting with the verb. So we've got a different rule here. Is it a sharp or dull pain? Is it a sharp or dull pain? If we want to use an embedded question here, what's the structure? Could you tell me? And there's one word that goes here. Could you tell me? There's one missing word. Does anyone know what it is? You can also do the next one. Does the pain bother you at night? Could you tell me? All right, have a go, everyone. Neverchan says, could you describe your pain? Is it a sharp or dull pain? That's a good sentence, Nev. Could you tell me if the pain is dull or sharp, says Helen. Perfect. We've got the word if, and here it is, everyone. Could you tell me if it's a sharp or dull pain? So when we have yes/no questions, we remove, we add the if or whether. Could you tell me if it's a sharp or dull pain? You can't say, could you tell me, is it a sharp or dull pain? That's incorrect. Could you tell me if, and then we reverse the order. It and the verb, we just reverse them, but we add if or whether. And the next one, does the pain bother you at night? Who wants to have a go at that one? Hamid's got it. Yeah. Could you tell me if it's a sharp or dull pain? So a few people are coming in with different options here, but remember what we're doing. We're trying to create a polite embedded question. So the next one is, could you tell me whether the pain bothers you at night? So we removed the helping verb does, and we've actually put the conjugation, we've conjugated the main verb bother. Could you tell me whether? I could also use if here. Could you tell me if the pain bothers you at night? Could you tell me whether the pain bothers you at night? Excellent, Adidev. Very, very good. Could you please tell me if the pain bothers you at night? Excellent. I would like to know if the pain is bothering you at night. Excellent, Helen. Good flexibility. Some great senses coming in from everyone. That's good. Al-Zubadi, Midhat, hello. And hello to Carolina. That's good as well. And the last one, why do you want a prescription for sleeping tablets? This is another why question like the beginning. Why do you want a prescription for sleeping tablets? That patient may need sleeping tablets. This is the last one. Could you tell me? Or would you mind telling me? And we've got to reverse the order. Jojo says, could you tell me why do you want? No, you've got to remove the auxiliary verb. Jojo, remove the auxiliary verb. Could you tell me why you want? Just remove the do. Can you explain why you want a prescription for sleeping tablets? So we remove the helping verb, the auxiliary verb. All right, and that's it, everyone. That's our embedded questions. So really useful one to get right. If you can use embedded questions, it's just an extra bow in your cap, or an extra feather in your cap. Another skill that you can demonstrate in this test. And it means you're being polite, and it means you're developing a good relationship with your patient. So embedded questions, make sure you practice them. They can be a little bit tricky to master. But once you get in the habit of it, not too hard at all, and you'll find that the word order will be coming out correctly. And also remember, with this type of thing, perhaps you have ingrained errors. Perhaps you've had difficulty. You've never really known this rule. So you've always sort of had that word order a bit mixed up. Well, now's your chance to correct any of those ingrained errors and speak with greater control and accuracy. It makes a big difference. Well done, Rashmi. May I know for what you want a prescription? I just stick with why on that mid hat, but yeah, you get the general idea. All right. Okay, let's move on. Next topic. So that's our embedded questions. Now let's talk about showing some empathy and reassurance. As health professionals, as humans, naturally you have a level of care and concern for your patients, and you want to be able to demonstrate that so that you can get their trust. Because remember, trust is not automatic, trust is earned, and you can earn that by your manner and the way that you communicate. So in language terms, there's lots of things you can do to help gain that trust. Showing empathy and reassurance is one way to do it. So I've got some sentences here, everyone, and you're welcome to add any comments to how you would respond to these, but I'm going to bring up some text and we're going to discuss and analyze the text. But you're welcome to put in any sentences that you like as we go through this process. So here's a patient who's concerned about chemotherapy and radiation. So imagine you're talking to your patient and the patient says to you, I've heard about the severe side effects from chemotherapy and radiation. That scares me. What if my hair falls out? All right, so we have a concerned patient and we have to help them overcome that fear. We have to show empathy, but we have to provide reassurance. And we're going to need to give a longer type answer here to use our knowledge to make that patient feel better. Now, as health professionals, you might have some strong opinions here on what you can actually add. So feel free to add your professional comments. And I've got some examples for you. So the first one says, it's true that a lot of patients experience hair loss with this treatment. So in that sentence, you're recognizing, you're stating the fact, it's true, it's correct. And it's also common to experience some nausea and vomiting in the early days of the treatment. But please don't be worried about these side effects as they are only temporary. So I like this sentence because it says, please don't be worried, but it also says why. This is very important, as they are only temporary. So you need to explain that the why here. You can't just say, please don't be worried, because the patient, you haven't given them a reason not to be worried. So we must give a reason. So please don't be worried about these side effects, as they're only temporary. And we can give you medications to stop the nausea. So there's a solution to that problem. And finally, your hair will grow back again. And in the meantime, you can wear a wig or a scarf. So you're providing a solution to a potential problem. And the important thing is it will help kill the cancer cells. So you're finding the benefits, you're describing the benefits of the treatment. So you can see here from one question, this health professional's gone into quite a lot of detail, explaining, giving empathy and reassuring the patient that it's worth it. Okay, so giving those longer responses is good. All right. The next one. I'm worried about my son's diagnosis. How can Tom manage his condition? Now tell me, what do you see in this image, everyone? What do you see in this image? What's happening in this image? What condition does the patient have? Can anyone tell me? And while I'm waiting, Mel writes, I understand your concerns, but the advantages are far more than the disadvantages, and the side effects are only temporary. That's great, Mel. And then you can go on. If you were doing that, you explain, let me explain some of the advantages of this treatment. You know, or you can say, look, although you may feel some nausea and vomiting, the good news is that this treatment is actually helping to kill the cancer cells, which is our main goal. Make it clear. Okay, everyone's recognized that this is about a patient with diabetes, and they're giving some sort of blood test to calculate the sugar levels. I'm not sure. That's your job, but I'll help you with the language. So this is a concerned parent about their son's diagnosis. So you get a lot of cards where it's a parent coming in with a child, and you're giving information to the parent about the child, not to the child. Let's have a look. Well, Mrs. Johnson, I can see that you're very concerned. Let me reassure you that if we can control Tom's sugar levels within the normal range with proper medication, he can live a normal life without any troubles. Okay, which is, I'm sure, that's what every parent wants. He can live a normal life without any trouble. So that's empathy. I can see you're very concerned. And then we're giving the reassurance. If we control it within the normal range, he can live a normal life without any troubles. It's going to reassure that parent. Okay, let's try the next one. This is about the medication. This could be like a pharmacy type. Any pharmacists in the audience today? This could be something you could get. And it's about the word steroid and how it can be misconstrued. The patient said, patient's worried about the medication, and they say to the pharmacist, well, actually it's the word steroid. Steroid's a banned drug, you know. The Olympics have just been on, and I've been watching the Olympics, and there's been a lot of talk about illegal drug use and banned drugs, and always the word steroids came up. So I suppose I just feel they must be bad for one's health. Right, I'm going to give you in the audience, are steroids bad for you? Are there any steroids that are good? Perhaps these are corticosteroids. How would you respond to something like this? Have a little think, everyone. Anything that you can add to this? And this is real patient concern. You never know, remember, on this exam, you don't know what the patient's going to say until you take the exam. So your responses need to be, you can't pre-plan them because you're not sure what question you're going to face, but you need to be listening actively and responding to that question. Yes, there you go. It's a misunderstanding about a drug name. Yeah, the patient's misunderstood the patient has misunderstood. I can imagine it can happen quite a lot. Kieran says steroids are not good. But Kieran says steroids are not good. But what about corticosteroids? What about corticosteroids? What about other classes of steroids? Is there any benefits of certain types of steroids? Perhaps the ones that have been prescribed. Carolina says, well, I understand your concern. However, you need to know that. Yep, good beginning, Carolina. I'll bring up my example. Let me assure you that there are over 200 different types of steroids. It's a large family. It's not a bad word, actually. This corticosteroid you've been prescribed is totally different from the one used in the Olympics. For you, the corticosteroid medication is very safe and will help manage your joint pain. All right, so there's an example of a response. The patient didn't know. They needed you as a health professional to explain that things weren't as bad as they thought. Kieran says corticosteroids are good. And Helen says that's absolutely true, but there are different categories of steroids. There are some groups of steroids used to treat certain disease with a great outcome. So we've got to talk about those benefits and perhaps educate that patient. All right, let's continue, everyone. That's empathy and reassurance. Let's talk about positive language. When I'm doing role plays, and I hear a lot of role plays, and one thing I often think is a really good way to make people feel good about asking questions is letting them know. That's a good question. I'm glad you asked. The good news is using these phrases in your own communication with patients will really help them relax and feel that there's no such thing as a bad question. So you're basically saying you can ask any questions that you like and I'll be happy to help you. So it's very positive and reaffirming. So now we've got a lovely picture of two puppies, but the question is, this is to a vet. Do we have any vets with us? It says, why is desexing recommended? Why is desexing recommended, the patient says. And the health professional says, that's a good question. As soon as you say that, it just sounds great. That's a good question. You see, as well as reducing the number of unwanted puppies, desexing prevents pets from roaming, fighting, or causing a nuisance to neighbors. So you'll have less to worry about. So again, that's what I call a 3-sentence response, everyone. That's a good question. Then explaining, you see, as well as reducing the number of unwanted puppies, desexing prevents pets from roaming, fighting, or causing a nuisance to neighbors. So that's talking about the benefits. And then therefore, so you'll have less to worry about. It's all very positive. Wow, Midhat's given us a lovely long response. I understand your concerns about steroids, says Midhat. However, not all steroids are harmful. In contrary, some steroids are used as therapy for many diseases, and that is what we use in our practice. Of course, there are some side effects that can limit its use, but usually their benefits outweigh their harm. That's beautifully expressed, Midhat. That's an excellent sentence. That's what you need to be doing on exam day. Going into that level of detail is very positive. Excellent work. Okay. Patient asks a question. Does this quit smoking program really work? Perhaps this patient has a addiction to tobacco, unable to give up, and wants to know if the quit smoking program really works. Let's see the response. Does this quit smoking program really work? I'm glad you asked, and yes, it does have a good success rate. Many of my patients have attended the quit smoking program and as a result have been able to quit smoking successfully. I'm sure it can help you as well. If you like, I can set up an appointment with the program coordinator. How does that sound? Okay, there's a lot of things going on in this little section, everyone. A lot of things you can take from here. One, I'm glad you asked. Positive response, building that relationship with your patient. But also using the call, you're acting in this exam, you're acting out a role. So you can create a little bit of content here and saying many of my patients have attended this program and as a result have been able to quit smoking successfully. Because remember, you're being an actor, you're acting a role. So in real life, this would probably be true if you were asked that question. So you can get creative and add this sort of information, because what you're really trying to do is convince the patient that this program is good. And calling on the success of other patients beforehand is one way of doing that. And then reinforcing. I'm sure it can help you as well. And then I like this next sentence. If you like, I can set you up an appointment with the program coordinator. Now that's really good acting skills, because you're actually imagining the scenario. And if you say that to the patient, oh, you're going to make me an appointment? You're doing all this for me? This is good. All right, I'll take that appointment. And then by asking the question, how does that sound? You're inviting the patient to respond. Hopefully they'll say, that sounds good. All right, so then they're committing by saying, how does that sound? When they say, oh, it sounds good, then they're committing to the involvement in that program. So it's a good technique. Nev says, I'm glad you asked that question. Nice. Thanks to this program, many of our patients could stop smoking. Perfectly, Nev. That's beautiful work. All right. And the next one. This is the operating theatre. I'm so worried. Maria's never had an operation before. Are there any risks? Are there any risks? It's a fair question, isn't it? Are there any risks? Perhaps this is a parent worried about a child, and the case we're looking at is a tonsillectomy. So let's look at this response. I do understand your concerns, but let me explain that there are certain risks with any surgical procedure. So you always have to be honest. Any surgery carries risks, so you can state it directly. Let me explain, there are certain risks with any surgical procedure. But let me reassure you, the staff here are very experienced with tonsillectomies and will take good care of your daughter. And serious complications are very rare indeed. The good news is it will reduce the number of infections and lead to better health. Okay, so lots of good sentences there. We're showing empathy. We're explaining that there are certain risks. We're being honest. But then we've got, even though there are risks, let me reassure you the staff here are very experienced. Now remember, again, you're acting, right? You're acting in your role plays. So you can bring on and just imagine that you are working in a hospital or surgical center where the staff are experienced. Let's hope they are. So you can use this to support and reduce any fears that the patient or the carer may have. And then you can emphasize that complications are rare indeed, very rare. And the good news is, what's the positive outcome of this procedure? It will reduce the number of infections. So again, we're giving longer responses, everyone. That's a really good skill to work on, trying to give that longer response, because that's what will convince the patient to follow your advice. Ahmed writes, I appreciate your concerns, but the good news is that's a very simple operation carrying low risks and with a very high success rate. Excellent work, Ahmed. We've got another one coming in from Rashmi. That's a really good question. Just put the article, Rashmi. That's a really good question. Yes, the quit smoking program is a really good program, and many of my patients have joined this and they're pretty happy that they've joined it. Good. The program has many strategies to help you quit, and they will also help you with the problems raised with quitting. Yeah, good detail there. Nehal's put something here in Arabic. That's a bit hard for me to understand, Nehal. Can't quite get that one. I'm assuming that's Arabic. Could be another language. Adidev says, I can understand your concern, Mir, but you put you don't worry. Just remove the you, but don't worry. It's a common procedure in this hospital. So far, we did not face complications. Put an S, complications for any patients. We have very expert surgeons, good, or just expert surgeons. As you know, for all the procedures, there will be some risk. Hope you'll be fine with that. I just removed that last bit. As you know, for all procedures, there'll be some risks, but don't be too concerned. We have a high success rate, or these risks are very rare. Okay, so that's risks and consequences. Let's keep going, everyone. We've got a few more to do. Talking about risks and consequences, one way to, you're going to get, let's face it, you're going to get non-compliant patients. I'm sure it's an everyday part of your job. Patients don't always follow your advice. So you need some techniques to deal with that. So that's what we're going to look at now. And we're going to use sentences with if. Our conditional sentences can help us achieve that. I'm going to give you some good examples here. So one way to persuade a non-compliant patient to follow your advice is to explain the negative outcomes associated with a certain action. And the core skill, again, the ability to expand and provide longer and more detailed responses, which you can see we've been doing today. This will help you to convince the patient to follow your professional advice. Now let's look at the diet on the right, everyone. Wow, we've got a hamburger and some chips. It looks very delicious. It looks great. However, it may not necessarily be in the interests of a patient with a heart condition or some other physical condition or ailment. Perhaps this isn't their desired diet, particularly on a daily basis. So let's have a look how we would deal with that. Patient says, I don't think I can change my lifestyle. Health professional says, I do understand, but if you continue to eat an unhealthy diet and do limited exercise, all right, everyone, here's your chance. Expand on that sentence. If you continue to eat an unhealthy diet and do limited exercise, what's going to happen? That's what we want to know. Can anyone complete that sentence? While I'm waiting for that one, I'll go to the next one. The patient says, I don't want to get out of bed today. I just want to rest. I just want rest. Well, that may not be in your best interest. The doctor said you need to start mobilizing today. If you stay in bed and don't move about, what's going to happen? What's the negative outcome there? And the next one, and we've got a person looking quite stressed here. I really need to start work straight away. I don't have time to just lie around. Response, it's natural to feel that way. That's our empathy. But if you go back to work too soon, okay, what's going to happen? So we've got 3 scenarios, everyone. I'll let a few people type in their responses and then we'll compare with the answers that I've got. And Adidev has been very expansive. We're going back to the one with Maria. I understand your concern, Maria. I think I read that one. Yep. All right. Let's have a look, see what else we got. Type in any responses that you may have. And while I'm waiting, I'll bring my first one up. So I've got here, so patient says, I don't think I can change my lifestyle. I do understand, but if you continue to eat an unhealthy diet and do limited exercise, you may put on more weight, which can in turn lead to a range of negative outcomes, such as high blood pressure, type 2 diabetes, and heart disease. That's why it's important to make some lifestyle changes now. Do you think you can do that? I like this response. because we're explaining what will happen, the negative health outcome, high blood pressure, type 2 diabetes, heart disease. And then we've emphasized that's why it's important to make some lifestyle changes. And then this sentence, do you think you can do that? If the patient says yes, you've just created a partnership. You've passed responsibility over the patient to make those changes. It's like a contract. They've agreed. So it's really good to get your patient involved. And this is a sort of language that can help you achieve that. That you can walk away knowing they can walk away. There's an agreement. They've said they would do it. You've given your advice what they should do. Now it's up to them to follow it. So that's a really powerful way of gaining some compliance. Lots of good sentences there. Grishma says it can adversely affect your health. You run the risk of. You possibly develop heart problems, therefore. You should think about better ways to change, or just think of ways to change the bad habits into a healthy lifestyle. Lots of great sentences coming up. You might expose yourself to unwanted consequences. That's great. The good news is changing your lifestyle does not mean you'll ban yourself from what you like to eat, but instead you may need to do some trimming. It's just some trimming. You're just modifying. Good. That's nice, soft work, Midhat. And Charlie says, I do understand, but if you continue to eat an unhealthy diet and do limited exercise, then I'm really afraid that your calories will increase. Just use active, your calories will increase, and it can affect your heart and cause other consequences. Nice, Anjali. Okay, next one. Patient says, I don't want to get out of bed today. I just want to rest. Well, we're going to say, well, that may not be in your best interest. The doctor said you need to start mobilizing today. And if you stay in bed and don't move about, what's going to happen? It may take longer to recover, and you'll be at increased risk of developing bed sores or chest infections. On the other hand, if you start moving about, you can build up your body strength and your independence. That will help you get ready for discharge. How does that sound? So again, getting that patient that doesn't want to get out of bed, explaining the risks, bed sores and infections. So that's the risk. But the positive side is, on the other hand, if you start moving about, you can build your body strength and your independence. All right, so that's positive news. And that's what we're getting some good sentences coming through. Again, from Dr. Nair, you might get pressure injuries or pressure sores, I think. If you start to move earlier, you'll have a speedy recovery. Great. Last one. This patient wants to go back to work. They're the opposite. They don't want to recover. They just want to go straight to work. Response, it's natural to feel that way. But if you go back to work too soon, then you may not make a full recovery and your condition may get worse. So that's why they shouldn't do that. You may not make a full recovery and your condition could get worse. Notice how we're saying may and could. We're talking about possibilities, not definites. The best advice right now is to get plenty of rest. Ask yourself, what's more important, your long-term health or your work? So the best advice right now is to get plenty of rest. And this is always a good one. What's more important, your long-term health or your work? Hopefully your patient's going to say long-term health. They will follow your advice. Rashmi says, if you stay in bed and don't mobilize, you might, yep. Don't use might will there. Might will. Remove the will. You might have well, that's gone back now. I've lost it. You might have DVT, pneumonia, or pressure ulcers due to lack of blood circulation. And it may delay your recovery. Good. Mohammed says, aren't we assuming his work is not important? Good. So you're right. So if that's making the assumption that work's not important, I don't think it's really criticizing. It's just emphasizing that the health is more important. But you could do something else. You could say, Ask you what's more, or you could say, the most important thing right now is your health, and that's what you need to focus on. So that's how you could respond. You could say, the most important thing right now is your health, and that should be your main focus. So you can adjust the language and trust your professional instincts. I think that that's really good, Mohammed. Adjust it to what you think is right. Okay, now that's risks and consequences, everyone. And wow, hasn't time flown? We've gone through all this conversation. I had a bit more prepared today, but this is a prep hour and we're just about out of time. So I might just close it there, but I might ask you all now to type in any questions that you might have about speaking, or does anyone have any concerns or anything that they'd like to comment on? And while I'm waiting for that, I'll check the last type in now from Dr. Nair. I do understand your concern, but if you need to work like before, you need more rest at home. Otherwise, your condition, might become worse. Okay. And what I might do, I'll just read this dialogue, everyone. I won't look at I've got one more dialogue. Type in any questions you may have, but it's a nice dialogue, so I should go through it, but I'm not looking at the role play task. I'll just bring it back. If you're watching the video, you can just pause. Here's the patient scenario. We're in a diabetic clinic. All right. Pause that and read that. And here's the health professional card. Again, pause and have a read. It's in the diabetic clinic. All right, let's look at our dialogue here. Nurse says, good morning. I'm one of the nurses here at the clinic. Can you tell me why you've come here today? That's our self-introduction, opening question. That's our embedded question in the beginning. Patient says, sure. Look, I've come here today because one of my feet is quite infected. Nurse says, I see. Would you mind if I have a look, please? That's again, would you mind if? That's polite, everyone. Would you mind if I have a look? Patient says, sure. Nurse says, I can see there's a lot of redness and swelling. It must be painful. It's a follow-up question. Yes, it is. Nurse, well, don't worry too much. We'll get it cleaned up in a moment. But first, I'd like to ask some more questions. Is that okay? So again, we've got empathy, reassurance, we're seeking permission. Patient, that's nice, that's seeking permission. But first, I'd like to ask a few more questions. Is that okay? Always nice to seek permission. Patient says, no problem. Nurse says, firstly, could you tell me how you cut your foot? Signposting and another embedded question. Patient says, well, I was out gardening and I stepped on the rose thorn, I think. Just a minor cut, I thought. Nurse says, and when did this happen? And this is a nice, just shows active listening. This refers back to the incident. When did this happen? About 3 weeks ago. And then we've got the follow-up. How did you treat the wound afterward? Patient, nothing really. I mean, I washed it and then put a bandage on it. I see. And did you change the bandage regularly? So again, this person's really following up. Patient, no, I just left it on. Nurse says, I see. Well, at this stage, your wound is quite infected. Is there any reason you did not come here earlier? That's probing deeper because the task says that the patient hasn't really managed their wound well. Patient says, it was just a minor cut, nurse. I just thought it would heal by itself. Nurse says, okay, well, that was not really a good idea. As you have diabetes, your foot may heal more slowly, leaving you prone to bacteria, which can cause infection and ulcers to occur. If the infection spreads, it can even lead to amputation. That's a serious outcome. We're using the if again, we're using our conditional sentence. Patient, oh dear, I'm not going to lose my foot, am I? And the nurse says, no, you're not. The good news is, positive language, the good news is, I think we've caught it in time and we can treat the infection. But you must remember to take all cut seriously. And if you see any signs of infection, you must visit the clinic immediately. So lots of practical reassurance, positive language, practical advice. Patient says, okay, I will. Let's keep going. Then nurse says, that's good to hear. Now the doctor will see you soon, but before that, I want to give you some general advice about foot care. Is that okay? So now positive language again and moving the topic forward. Now this is education. There are a few things you can do to keep your feet in good condition. That's our topic sentence. There are a few things you can do. Firstly, I recommend that you inspect your feet every day. Do you think you can do that? Getting patient involved. Patient says, yes, but what am I looking for? That's a good question. Keep your eye out for any minor cuts, blisters or swelling, those sorts of things. Right. You also need to keep your feet clean and dry, especially between your toes. If you don't, it can lead to cracked feet, which can then become infected. You don't want that to happen, do you? So again, more consequences, everyone. Patient says, not at all. Not at all after this event. Nurse said, I would also suggest keeping your nails trimmed. Can you manage that? Patient says, well, I can, but it's a bit hard. I find it hard to reach my toes. Nurse, yes, I understand that can be difficult. Perhaps it's time we referred you to a podiatrist. They can help with foot care. How does that sound? Again, practical advice. Patient, sounds like a good idea. Thank you, nurse. So patients come in with these concerns. You've addressed the problem. You've provided practical advice, given solutions, successful outcome. So everyone, that's an example dialogue, and I strongly recommend you practice writing out dialogues to build your skills. Look at the patient side. Imagine in your mind what questions the patient would ask and look at ways to respond. Now, we've got lots of great stuff on our website, everyone. I'll get to that. But last thing to say, final useful tips. The KISS method, keep it simple, stupid. That means don't get too technical. Don't use medical jargon that your patient would know. Use language which is easily understood. Another good tip, chunk and check. What does that mean? No monologues. It's a dialogue. Give information in manageable chunks, not too much. Always check for understanding along the way and allow the patient to ask questions. And then use the patient's responses to guide you on how to proceed. That's your active listening. Lastly, offer choices and involve the patient. So ask questions. You need to exercise regularly. Do you think you can do that? You're going to get a response, create an agreement. I can arrange a community nurse to provide support at home. How does that sound? That more interaction and involvement you get, the better your communication. All right, now, if you want some expert guidance, we have an expert team of teachers dying to help you improve your language skills. So we offer one-to-one sessions using Zoom or Skype. We've got an online booking system, excellent teachers getting great success, and we've got great material for all professions. So the recent exam results just came back, and the success rate among our students was extremely encouraging. So if you do find speaking hard, just check out the options online. I'll give you our website, everyone. We also offer writing classes and virtual classes online and group classes if you're in Brisbane. So wherever you are around the world, we can help you. And I'll just type in our website if you don't know. You can find us there. And there's a link on the Facebook page that just says sign up, and you check that out and you'll see all our courses, everyone. All right, so thank you, everyone. And I'll just answer a couple of final questions. Sarah says, do I have to ask the patient his or her name? I think it's a good, Sarah. I think that's good to do. That means that you can use that name in the role play. So that's a good strategy. How can I use the 3 minutes best to prepare, says Ahmed? I would look at that case and I'd be thinking about the symptoms. For me, in that 3 minutes, look at what you have to do. But a really good way is think of 2 or 3 questions that you can begin to get the interaction going. So start by asking some questions. If you have to take a history, I'd make some notes about your possible questions that you can ask. Or if you're asking about symptoms, if the condition is like hypertension or an injury or a virus, think about the common symptoms and then ask the patient if what symptoms they're experiencing. That will get the interaction going. Jojo says, can I write or mark the role play card during the 3 minutes? Absolutely, Jojo. You've got a pen and you can write on it. It's not for recycling, so you can do that. Madhu says, is there any alternative if I can understand your concern? Sure. I understand what concerns you. I can see that you're worried, those sorts of things. Sarah says, as the examiner already told me his name at the beginning, yeah, use it then. Use it, Sarah. No worries, Rashmi. All right, thanks, everyone. I think I've got all the questions done. All right, now stay online, everyone, if you want to know about our courses. In another 7 or 8 minutes on this Facebook Live session, we're going to be doing a live virtual class orientation. I'm going to talk about our orientations starting on December 9. So if you've got a plan for January 11 or beyond, come and check out that session. Yep, starting in a few minutes, Anjali. So we'll have another session starting very soon. Bye for now. Wish you good progress. We'll see you for the next session in a month in 2020, everyone. Bye for now.